Hi, welcome back to the Essential Coaching Skills Podcast. I'm Doug O'Brien, your host. My guest today is Sharon Waxkirsh. I'm not sure I'm saying her name right, but she's the founder of the Academy for Hypnosis and co-founder of the Institute for Hypnotherapy for Medical and Dental Practice. I'm very excited to have her here because I've been doing that sort of stuff with patients and doctors and stuff for a long time, but not to the extent that she has. She's made a career out of it, and she's trained hundreds of medical professionals in hypnotherapy, earning recognition as an expert in the field. She's one of the few trainers licensed to teach Gilboyne's transforming therapy and is highly esteemed for her work in educating dentists, doctors, surgeons, and hypnotherapists worldwide on the application of hypnosis in medical and dental practices. So I'm really excited to have her here. So with no further ado, let's get this show on the road. You are listening to the Essential Coaching Skills Podcast, a show devoted to uncovering the systems and the secrets that set the best apart, where you learn how to take your coaching clients to the next level, while you grow the coaching practice of your dreams. So sit back and relax, or sit up and get excited. Either way, you might want to pay attention. This could be important. Hello, Sharon.
Hi, thank you for having me.
Oh, it's a pleasure. Like I said in the intro, I don't know if you heard it, I'm very excited to have you here because I want to know what you know. And also, I'm very sorry if I mispronounced your name. I suspect
That's all right. It is exactly as it's spelled, Waxkirsh.
Waxkirsh? There's no X.
That's
And
it.
I have a Wakirsh.
And it's all wrong.
How's it supposed to be spelled? I'm reading your bio.
That's strange. It's Waxkirsh.
Oh, that'd have been a lot easier.
Well, it would be.
Should check your bio's missing the X.
I will check on my bio. I apologize. Yeah, I have actually a virtual assistant but she's virtual.
And when you say virtual, she's like a human being someplace else, or
she's a human being in another country, and I just kind of let her get on with things because that's. I'm not saying it's lazy. I'm just saying I'm lazy to not look through what she's done.
I would have thought she got that part right. Everything else maybe not.
Occasionally she does things wrong, but that's okay. She's forgiven.
Well, thank you for being here, whoever you are. So I'm just really, really curious. Let me just back up a little bit. I've been doing hypnosis for a long time, and as many people know, I'm a musician. I have degrees in music. I do not have degrees, formal college degrees in psychotherapy or anything like that. So getting into like some places like the hospital was just kind of lucky. When I was working in the Department of Complementary Medicine, it was because they were doing a study of whether or not, alternative medicines like hypnosis, as an example, could be a viable application in a hospital. So they needed people who were not doctors. And so I fit the bill perfectly. But it's been really hard for me to get into, established medical situations, et cetera, because I'm not being a doctor. And you are not a doctor either, Sharon Waxkirsh.
No.
But you have somehow been training all these doctors and all these surgeons and all these dentists. And how the heck did you establish that for yourself? I mean, that's a pretty cool niche, if you don't mind my saying so.
A lot of hard work, a lot of groundwork, a lot of networking, a lot of convincing, understanding where they come from, and just offering my services when it wasn't necessary for hypnosis for surgery, offering my services when it was important for the doctors to be able to work on their clients who were refusing to come to the surgery and things like that. So they got to know me, and people got to know what I do. I think part of it was my training. The training that I had done was quite highly focused on medical and dental hypnosis. You talk about your training being in Ericksonian. Mine was Elmanian, so Dave Ellman, who specifically taught dentists and surgeons as a lay hypnotherapist himself. He was, in fact, a radio show host. And so he managed to break the boundaries himself, in the 1950s and 60s. And it has definitely been not easy. And I think in some ways it's harder nowadays because of the suing issue, especially in the US. And in some ways it's easier because if people who want to market themselves, as in dentists who want to market themselves as being friendly and kind and open, they're more willing to put that as part of their repertoire, simply because it opens the door to, especially to clients they would never see. So, for example, I would go to huge conferences and I would, I'd have a, room of dentists, and I'd say, well, how many of you are seeing phobic clients? And all the hands would go up, of course. Where I said, no, you're not. None of you are. Your phobic client doesn't come through the door. You have high anxiety clients, but you don't have phobic. You're not getting the phobic. If you really wanted the phobic, you'd have to go to their home. You'd have to break down their door. You don't get those people. So I kind of introduced it as a marketing ploy for them. And so doing it that way, it made sense. Now, it definitely worked in the UK. It definitely works a lot in Europe because there's a different sense of let's say, legislation and suing culture. We don't have such a ready, oh, look, you did something wrong and now we're in trouble. Or, there's more kind of openness and willingness to try. In the US, I found it to be a little bit more confrontational with especially even in the dental practices. Why would I need you? I've got my drugs. People need this, and then I'm like, well, there are a bunch of people that don't want that. So it's sort of been a question of saying, hey, have you thought? Can you turn your mind to this? And one of the other things that I'm very keen on is making a lot of videos to show what can be done. Of course, you see on my YouTube channel a fraction of what I do. I mean, that is literally just the ones who say, I agree. There is lots and lots of people that I've worked with who don't agree to be filmed, and I understand that. And that's actually, I always find it upsetting because it's like, they would be really useful, even the ones who are terrified. I'm like, yeah, well, we still can use your information because there's tons of people like you out there who are getting this stuff. So breaking into the thing, I think part of it started many years ago with my teacher and colleague at the time. My teacher became my colleague, where we started the Institute of Hypnotherapy for Medical and Dental Practice, simply because he also was trying hard to get into that field. And somehow at some point he was asked to do a movie called Hypno 5 Live, and that went out on TV. And I knew a surgeon at the time, and we were just chatting about it, and he said, I'm going to have a friend event, come and chat to some of my friends and meet them, but don't tell them what you do because that would be embarrassing. And I said, okay. So as soon as I meet all their friends, they say, what do you do? And of course I told them. And then they said, oh, did you see the Hypnosurgery 5 Live? And I said, absolutely, I did. And they said, can you teach us? And I had just finished my own course. And I said, well, I can't, but my colleague can. So I already decided my teacher was my colleague. And so I wrote to him and I said, look, we're going to get this. We're going to start teaching. And we ended up doing some courses for surgeons and anesthetists. And it was interesting because we ended up having that course accredited by the Royal College of Surgeons. And that's quite an accolade to you have to keep those things up. And my colleague at the time wasn't prepared to do that because he had other things. There was plenty of things going on in his career. He was busy. I didn't feel confident at the time to just do this alone. But what happened was we ended up doing sort of surgeries, dental surgeries in conferences. So sometimes they have like booths where they show a new technique. And so I said, well, I'll come along and do these things. So I actually went along and did some of these surgeries in the booths, and he didn't show up. And so I was like, on the phone, can you come? Can you come? And he's like, no, I'm busy. I'm in a traffic jam and I can't get there. And I was like, okay, so I do the next one. And can you come? Can you? No. And I ended up doing them. And then afterwards he said, right, you're done. He said, you know what to do. And it was a really nice way of him handing over the baton to me and saying, okay, you know this stuff. You now your confidence is there. You can do it. And so he said, take over all the dentists.
Wow.
So that's what I did. And I
kind of threw you in the deep end there and said, hey, swim, girl.
He did. And, I mean, that's the best way of practicing what you preach with hypnosis.
Yeah.
So I just said, right, that's it. I'm going to do this. And I put my all into creating dental contacts, and I got back what I needed. People were saying, hey, I want to do this. I want this. And especially children's dental practices.
Really?
Yeah, so I worked a lot with kids, and I still do. I have a dental practice in the UK that call me regularly. I train up all their group every year. I go in at Christmas time. I see them. I do a training, and because they have quite a high turnover of staff, and not because they're a bad dental practice. It's because most of the women are their women. So they really have pretty much an entire female force, and many of them are young. They get pregnant, they move on or change. So I'm constantly going. There's a few core people who know my work and just love it. So it's for them, it's a kind of not only a training, but I sort of do work with them to relax them and help them see. But they've watched me in practice. I've done work in their practice. So I think for me it was a question of going in, doing stuff. But now I've done during the pandemic, I still had people who wanted teeth removed, no anesthetic. So I ended up thinking, well, can I do this on Zoom? Can I do this on WhatsApp? And the answer is yes. So I realized actually I can do this around the world.
Wow, cool. Yeah, Zoom has been amazing for us, especially during and post COVID. It's been, I mean, look at us right now as an example. Wow. And when you said there's people who want to have teeth extracted without anesthesia, it's like, well, who wants that? Who wants that?
Quite a lot of people.
Really?
Quite a lot of people. There are different reasons for it. So everybody has their own reason. Some people have multiple allergies, and anesthetic is one of them. Kids specifically, I think, shouldn't really be given anesthetic for some of the operations that they have done. They're mostly minor. Tooth extraction is not a huge thing for a child. And if you're a child and realize that you have an ability to use the power of your own mind over your body at 6, 7, 8 years old. I mean, I've done it at 2 years old, but that was tricky. But in sort of from the age of about 6 or 7, you're set for life in a certain way. You realize what you have as a control, and nothing becomes a challenge in the same way when you realize, well, hang on, my mind is there and it's available to use. And I give them that option. I certainly don't tell them I'm doing something to you. It's tricky when I have a mum or a dad who says, oh, Sharon will do this, Sharon will make it so that you don't feel any pain. And I have to come in and go, actually, that's not quite how this works. I come in and facilitate your child to use their own mind to numb themselves, whatever that means to them. And they might feel something. It's not a question of being completely numb. Most people do not have anesthesia. They have analgesia. And when they understand that, and it's harder to explain to a 6, 7-year-old because mummy's told them they're not going to feel anything.
Right.
And that's not true. So, I mean, it can be true, but it's generally not the truth. When you're having something done so fast, you do tend to have an analgesic effect rather than an anesthetic effect. Whereas when you mentioned about having a hernia operation done to me, you were talking about that. you can then go into an anesthetic effect because you have more time to kind of process mind-wise what's going on. And your brain, I think the brain really sorts it all out for you. I think my approach is less is more. Do less, give less, and your client or patient will actually have their mind kick in to do what it needs to do, as long as they're on board with what they need. And most of my clients are, because they've wanted it.
Right.
So there's multiple reasons for people not doing this. I mean, drug addictions.
Yeah,
it's
right. Just so people can catch up to what you said a moment ago. Yeah, I had a hernia operation done without anesthesia. I just did hypnosis for myself, listening to a recording that I made for myself. And I did a lot of preparatory work before. It wasn't just like walking in and say, let's just do this now. I'd done a lot of prep work with a colleague to be in a state where I felt confident I could do that. And I, again, would not say it was anesthesia per se. I was not numb. I knew that there was somebody like doing something. I could feel the pressure, sort of thing, but it didn't hurt. For the most part, there were little moments that little flashes of, like, what was that? But it was funny because after the surgery was over, the doctor came and she said, this is what I took out of your body. And she took this little vial thing with this thing floating in it. And I said, you took something out of my body? I thought this was hernia. We just stuffed it back in and sewed it up. She said, well, no, actually, once the intestine has been distended like that or whatever, we have to cut off that little part and, put that back together and then stuff it in and sew it up. I said, I wish I'd known that. Wish I'd known.
Do you feel that you wish you'd known it, or would that made it harder?
I would have been more prepared for it.
Oh, really?
Yeah, in this particular case, I was.
That's interesting. That interests me, because sometimes I feel like sometimes it's better to not know what's going on, so that you can in a way, just let your imagination just go somewhere else or whatever.
Yeah.
Sometimes it is better.
That's exactly what I did. I may be wrong, but I can only say I didn't know what was going on, so it was fine. Maybe if I had known, it would have been worse. Hard to tell. I'm a person. I'm just an experiment of one here, so I don't know.
Yeah.
But I will say this. There was a moment in the surgery where they have this oximeter on my finger, this little device that monitors your heart rate, which is typical in surgery because they want to, gauge your heart rate to see if they need to add more anesthesia or not, because you can't move with general anesthesia. You can't scream with general anesthesia, so the only way they know if you need more pain-killing part of the anesthesia is if your heart rate starts going up. So they need to monitor that. So my heart rate was fine, nice and low, but then it stopped. As far as the oximeter, it didn't pick up my heart rate anymore for some reason. It was like too tight on my finger or something like that. So it started like flatlining. Obviously, I wasn't dead. I was like, how you doing? I'm fine. It was clearly not actually dead at that point. But she said, could you move the oximeter to another finger, please? I said, sure. So I had to sort of come back from where I was and sort of move the thing over to another finger. And it was like, oh, there's the heart rate. Good. And then I had to go back to Hawaii. I had to go back to where I was at a beach.
And, yeah, it's interesting. I mean, I think people misunderstand a lot of what's really happening in the hypnotic state. It is, to me, it's a wave. You're up, you're down, you're up, you're down. And it's like you peak, you listen, you're there, you're not there, you disappear, which is lovely. And then you kind of rise up, and then you're kind of, oh, what's going on? Oh, that might hurt, and then down again, because that's a stupid idea, and then down again. And sort of, so it's, and these things do affect you. I mean, one of the things that I like to do if I'm actually working with a client, in the chair, in the surgery itself, is you can see what's going on with the client. You can see when they're kind of lifting out their body. You can see when they're kind of rising. And that's when I can sort of say, hey, go back down. Whereas when you use your own recording or even just your own voice, you have to kind of go, where am I? Oh yeah, now I need to check. I mean, I did the same with with the first time I had a filling done. Well, it was just a filling, but it was actually a very deep one because it was a refilling filling, so it needed to go to the nerve. Um, I remember at one moment I said to myself, "Oh, this could really hurt." And I said, "Sharon, what are you doing? Come back, go back, don't go there." And then on another occasion, I had my wisdom teeth taken out, and the dentist was telling me everything he was doing, which was not good for me because he was chatting. I said, "Don't tell me what you're doing." That's what I asked him. And he actually, he told everything he was doing, which was great for the film because people knew what was going on. But in my head, I had this moment where I had this idea that my whole skull was being sucked out of this hole through my tooth. I mean, my imagination went nuts. And I was like, oh, wow, where am I going? What's, come back. Nothing's happening. And that was because he was telling me what's going on. Now I'm going to do this. And I was like, I don't want to know those things. I'm lifting up the flap. I'm like, I don't want to flap, you know. and then one of the things that I was really nervous of, in fact, out of everything, was having the stitches put in. I was like, to me, the gum is hard, and to stitch into something hard. Anyway, so when that started, I was like, okay, I'm going to have to really rethink what's going on because I'm not going to, I don't know if I'm going to like this. So I just decided it was like flossing my teeth.
Yeah.
And so I said, oh, this is like tooth floss. I've done this every day. I can do this. This is tooth floss. And so I just kept saying to myself, tooth floss, and that was fine. So but at that point, he'd already no, the second time I had a wisdom tooth out, I had a friend sitting by me who was also a dentist, and he said, I really want to see you do this. So I said, okay. So I went and did another wisdom tooth operation. And again, I said, last time the dentist, it was a different dentist, but talked all the way through. So I thought, oh, I'll stick some earphones in like you did, and I'll just do it myself, which wasn't the best way for me. I actually feel like I need to know what's going on around me, but just don't talk. This is kind of like a bit not quite right. But then my friend who was sitting there goes, oh, it's all done. What he meant was the tooth is taken out. I didn't know that.
Right.
It wasn't all done.
No.
I had stitching to go through. I had other things to be done. So I had said, oh, it's all done. So I had taken myself out.
Oh
And
gosh.
then he said, oh, now I need to do this. I was like, what? And
What
so
do you
I
mean?
then had to quickly put myself back. So I wasn't in a hypnotic state for those stitches. And
Right.
I will tell you, it changed. I was like, oh, so this is what it feels like when you're not in hypnosis. It hurts. And I
Wow.
didn't know. And it was kind of good to have that sense of, I must have really been in hypnosis for the
Right.
for the tooth extraction, because now I'm having this part done and it actually hurts. So I was kind of proud of myself that I knew I was in hypnosis, because
Hmm.
otherwise there's very little gauging. You
Yeah.
can't, it's hard to know, am I really there?
Yeah. No, I
The
get it.
brain has to trust it.
For sure. For sure. It's in hypnosis, everyone who's listening who is a hypnotherapist knows that we do things like convincers to convince a person that they're in a trance. It's important for a person to say, yes, I am in trance, and to believe it. It's important to have that, to be convinced that I'm in a trance. And there's nothing more convincing than having a tooth extracted, or, while and feeling no pain while these people are doing these things. It's also one of the things I learned in doing work with patients is that to use words like pain is not a good idea. As though this is going to hurt is not a good idea. You might feel some discomfort, might feel some pressure. To
Mhm.
change the languaging of things is really important.
Absolutely. I mean, I do meet dentists and surgeons and, doctors. I saw one just the other day, and she was curious about what I do. And she just, it wasn't necessarily I was going to be teaching her, but I just said, well, this is what I do. And I said, and I'll give you some tips for your own work right now, if you want. And she was like, okay. So I started explaining to her. I said, what would happen if you told your patient this rather than what you are telling them now? And she was like, oh, that's great. Oh, I could
Mhm.
do that. I'm like, yeah, it's so simple to shift, and I said to them, if you go into your patient after they've had surgery, for example, and you say 1 to 10, how much pain are you in? And 1 being the least and 10 being the most, I said, they're going to look for their pain. If you go into the surgery and say to them, how much comfort are you in, 1 to 10, they're going to look for their comfort level. And that's immediately going to shift it. It's very simple.
Yeah.
But it's a waking suggestion. It doesn't take a great leap, and it will make a big change. When I had my spine surgery done, which was with anesthesia, I have to tell you, because my surgeon would not do it without. It was very, very precarious, the surgery itself. And she said, Sharon, if you breathe the wrong way, you might not have the ability to walk again. I said, I don't need to do this. Okay. I just, you've given me the info. That's enough. But afterwards, I didn't use any morphine, any painkillers at all. I just immediately went straight into hypnosis. And during the surgery, I had my earphones on whilst I was in general anesthesia. So I came out of that state quite euphoric, which is a state that happens when you use hypnosis, even with general anesthesia, which I do a lot with my clients.
Yeah.
And then afterwards, my healing was incredible. So that surgery was just incredible. I had the pain nurse come in. I said, don't talk to me unless you want to have a nice chat. But we're not talking about pain. So that was interesting. And all the nurses were very interested about what I was doing. Lo and behold, I had to have a second surgery just a few weeks later. Long story short, it happened again. My spine went back into the surgery. And afterwards, the nurses said to me, would you like to try morphine? And I said to them, why not? Let's do an experiment. Let me let go of the hypnosis. I know that I'm not in any pain right now. I know that I can do this, and I'll see what it feels like to have morphine, because I'd never had it. So they gave me the morphine, and my blood pressure dropped. It went so low, and they had to get me tea and cookies, and I could suddenly feel everything. I was like, whoa, what is going on? I was like, this is how I feel. This is the pain. And I said, do not give me any more morphine. That's it. I'm done. And it was a great experiment. I'm a bit of an experimenter, but it was a great experiment to see how, again, the convincer, how is hypnosis really changing me to what could I be experiencing? And I was like, it was night and day. It was absolutely night and day.
That's amazing. That's an amazing story. When I did my hernia surgery, I had no real pain during the surgery, except for that one moment that I described. But going home was challenging. I had, the great thing about it was there was like virtually no recovery period. Like I got up from the table, put my loose fitting clothes on, and got into a taxi cab and drove home to Brooklyn. But that cab ride was painful. They was hitting potholes in New York and stuff, and turning corners and stuff. That was not fun. And they'd give me a prescription for Percocet, I think it was, and I took one, and it was terrible. I like you with the morphine, it's just I did not enjoy that at all. It didn't do anything. So I just applied some ice and watched some Fred Astaire and Ginger Rogers movies, and just
oh, I love Ginger Rogers. So that's the thing. People think, you can give yourself leftover suggestions, and you want to say to yourself, make sure that you stay numb until all the healing process is complete. But those little things like the potholes, the turning the corner, these are acute moments, and to stay in a hypnotic state during that time, it's very difficult, because you're trying to navigate something that you want as a whole experience, whereas there's things really quite physically happening. And that's why I say doing hypnosis for surgery for the mouth can be quite challenging, because it's, oh, I've got a tooth here, oh, then I've got a tooth there, oh, now I've got, and you're sort of swapping from tooth to tooth, or you're doing one after the, it's not all in one go. I especially notice that if I go for a teeth cleaning, and I will put myself into hypnosis, but I notice, because of the amount of movement that's going on, I can't numb my whole mouth completely at this right time. And then she gets to a point, she's doing something, and oh, that feels now calm, and oh, now she's gone over there, oh, now I have to do it again, so it's the movement. But I think even doing it on a really speedy level, you can still do it, and you're still going to get a much better result. And you're not going to walk away traumatized. You're not going to walk away feeling like you haven't accomplished something. You're going to feel like, oh, that took, I do, time distortion, that kind of stuff. It took only a matter of minutes. I coped really well in that situation. And actually it became more enjoyable. I was cool, when I have my mouth cleaned or something, my teeth cleaned, I just it's a massage for the mouth. It's my spa time. I go think crocodile, and just let the bird come in and do its thing. So, but there are ways of thinking about it, and it's really different for each client. I have to tell a story. You mentioned yourself being a musician, and one time, and you mentioned about a lot of preparation. There are times where I have zero preparation, no time to talk to the client, no time to tell them even what's going on, which is pretty intense. And I remember I came into a dental practice and they said, okay, this person wants no anesthesia and they're phobic, whatever, or they're high anxiety. So I was like, okay. And I said, what's your problem? What's really troubles you? And she said, oh, the sound, I can't handle the sound. And I said, okay. So she started the work, and there is a video of her doing it. I think it's on my YouTube actually. What was a dental practice? Covent Garden Dental Spa. So I think they even have a video of her on there. And I just said to her, just let every sound be like a music to your ears. Make every sound like an orchestra. Make it so it's a musical. And, I didn't know this person, never met her before in my life. Anyway, afterwards, she said to me, oh my gosh, you couldn't have been more appropriate. And I said, why is that? And she was actually a very well-known musician. She just played for the Prince William for one of his birthdays. And she said, it couldn't have been better. She said, now everything is music to me.
Nice.
So, but I have people who have problems with sound. I've noticed, I've asked them, and I like doing an experiment. I like doing a little bit of research into this. And I've asked them, do you have a musical ear? Are you somebody who, has kind of a good pitch, or you like music? You don't have to be a musician, but you like, and more often than not, it's a yes. So I found that the people who have the most fear of the sounds are people who are really involved in sound.
Yeah, that's one of the reasons I was telling you before we started the podcast that I am so impressed that you do dental hypnosis, because for me, the hernia operation was pretty easy. I just left town. My body stayed in the operating room, and I was gone. I was in Hawaii. I was having a good time on the beach. And I came back when the surgery was over, basically, or that moment where they had to move the oximeter. But with the dental surgery, I was saying it's like you're there. And I'm not able to just say, hey, calm that tooth. I can't do that. But for me, it's also the sound of that drill when they go, it's like, yeah, I can't,
Yeah, and that is because you have a musical ear, and that's the thing I have found with just about every client that has a sound issue of the drill. And I was like, oh, this is really interesting. People that the noise really affects that. So if you kind of say, well, what if that drill wasn't a drill? What if that drill was actually an instrument that I could include into my composing? What would that really sound like? And then you're busy in your mind with like a new composition with this kind of noise, and it just changes. The reframing it changes quite intensely.
Yeah, I'll try it next time.
Go for it. Tell me how it goes.
I will say this. It's interesting that you should say that, because Beethoven was deaf. I've got a bust of Beethoven. You can see him over there.
I can see him.
Beethoven was deaf, and as he got deafer, he actually created this apparatus so that he would basically bite his piano. So if you go to the Beethoven Museum in Bonn, Germany, there are teeth marks on his piano. But then he built this apparatus. He didn't want to be bending over, biting the piano all the time, so he built this extension, this wooden dowel, basically, that he could bite. to hear the music, because when it was vibrating in his jaw, he could hear it. Because the bones of the skull made it so that he could actually, hear the music that he was playing the piano. It's because all the vibration went in through that. And I've done an experiment. I've played with this where you bite something and then have it vibrate, and you can really hear it throughout your whole skull. It's amazing. It's an amazing thing.
Yeah. So I don't actually use earpods. I use one of those earphones that actually sit on the bones, so I hear that way, and it's a much better sound.
Wow, I haven't tried those yet.
They're fantastic. They're fantastic because I don't like having things in my ears.
Huh. Okay, I'm learning a lot today. So I asked you earlier if you know Kay Thompson, and you know a video where she did some interesting experiment. Kay Thompson was a dentist back in the. I met her, so she lived probably at least until the 90s. But she was around Milton Erickson's generation. Maybe she was earlier. Maybe she was a generation younger than Milton, but she was a student of Milton Erickson's. And she herself was a dentist, and she was a great advocate for doing what you do, basically. And there are videos of her doing an experiment where a doctor puts a needle through her hand and she's bleeding pretty copiously because it's a pretty substantial needle. And then she says, okay, now I'm going to stop the bleeding on this side of the cut, and it stops bleeding. And then she says she's still bleeding on one side, but not the other side. And then she says, okay, now I'll stop the bleeding on this side. And she stops the bleeding on that side. And in the video I saw of your surgery, you say the doctor tells you to let it bleed for a while, and then stop the bleeding. And you go like, okay. And like, how do you do that? Because Kay Thompson is not around for me to ask this question. But how do you?
That's a good question. I couldn't tell you the real answer to what's actually going on. I think Mark Jensen, who does some of the research on hypnosis for pain control, might have, because he's doing all the neurology. But I don't actually know if he knows about the bleeding.
What do you do? I mean, what do you do? You just say stop bleeding, and
I just say stop. I mean, here's the most interesting and fascinating experience I've had. And I've done this with plenty of clients, of course, stop the bleeding, and they've stopped, and it's just shocked dentists. They just sort of like, really? But here's the most fascinating one. I don't know if you've seen everything on my YouTube channel, but okay, so here's one for the books. I'm the first person in history, I believe, to do a hypnosis on a dog for a hernia operation. So it was a 90-minute hernia operation. On a dog, and video is there.
Okay.
And at one point the surgeon nicks an artery and blood just shoots out, and I just thought, he's got to stop the bleeding. So I said to the doctor, does he need to stop the bleeding? And he said yes. And so I just said to the dog, stop the bleeding. And I went like this, stop the bleeding.
That's crazy.
So don't ask. So at the end of the day, I can't give you a real answer to that, other than you just tell yourself to stop. In some cases, I'll tell clients, turn off the tap. But I do the same thing for clients who are bedwetters. Turn off the tap. Just tighten up the screw. Don't need it, and that's it. My theory is the brain knows what to do. It knows what to do and when to do it. It doesn't want to do self-harm. It wants to do self-good, especially if it's having an operation, because it knows deeply it's going towards healing. And so the point of even doing it on a dog, it knows that bleeding is not going to be a successful ending. So, going through all that and then just bleeding, no. So the brain says, as long as there's kind of even the command, stop, it's like, that's it. Okay, you don't need to do that. I think I kind of learned that a little bit of that from Dabney Ewan, Dabney Ewan's work. Do you know Dabney Ewan's work?
No.
Very interesting. He passed away only a few years ago, in fact. He used to work in a hospital in New Orleans, specifically for burns victims.
Mm.
But I remember he was always present. He came with the ambulance, and he was always present for big accidents and things like that. And there was a road car accident, and somebody obviously was really badly injured. They were bleeding from main artery, and he went straight to them and he said, "Stop your bleeding. You've washed your wound, stop the bleeding." And the bleeding stopped.
Was he a doctor?
He was.
Okay,
He
yes,
was.
I've seen
Yeah.
some videos about him.
Yeah, his brilliant videos, brilliant work. And
Yeah.
so he stopped and that client stopped the bleeding. And then people started gathering around this person who was pretty much under a car at the time,
Yeah.
and the car needed to be lifted. And so people started gathering around and started going, "Oh my gosh, you're in such a terrible state," all these things,
Right,
we need to
right,
get you out of there, and all this stuff. And of course the bleeding started again.
right.
So Dabney Ewing came back because he was busy with somebody else, came back and he said, "You've done it once, do it again, stop your bleeding, ignore everyone else, you're going to be fine." And it happened again. So it's a question of sometimes having that authoritative command,
Yes.
even if it belongs to you,
Right.
gives you that almost that childish shock, like, "Oh, I've got to stop,"
Yeah, yeah. No, it's true. I have a friend who wrote a book called The Worst Is Over.
I've
You know,
heard of it. Yeah.
yeah, wonderful book. And those are great, like, verbal first aid words to say to somebody. Most people don't do that sort of thing. Most people go to an accident victim and say, "You okay? Are you okay?" And of course they're not. And they have no reason to think that there will be, because, oh my
Yeah.
God. So, but to go to them and say, "The worst is over. I've called the ambulance and
Yeah.
you're okay now. Just
Yeah.
stay with me, and
Yeah,
stop."
and I think that terminology also came from, I believe it was either Dabney Ewing, or because it's pretty old to use that. But all of this stuff comes from some of the, and Dave Ellman used to use it. Some of these really old timers, they just knew everything that we needed to know. There isn't much else apart from now the neurology, which is what we're discovering. That to me is what's new in hypnosis, is the technology and the ability to technically change things with computer and things like that. So that I find more fascinating than just kind of regurgitating a lot of what we've already done. We'll see.
Yeah. Well, it's everybody is an experiment of one, and
I agree.
I think it's really amazing to see what things that work for some people maybe not working for other people. But there is also a commonality. We are all humans with this brain, and et cetera. And very often what works for other people does work for us. And I think there is a lot to be learned for, like, holy goodness gracious, you can stop your bleeding by saying, "Stop. I want to try that. I want to go right now and just put a needle through my hand right now and just stop the bleeding."
So here's something that I teach my students, and have I got them here? No, I work a lot with clamps. So I teach the students to learn how to numb themselves with surgical clamps. And very often they come back to me and say, "Well, it didn't work. I couldn't do it. It didn't work." And I'm like, "Well, that's because it doesn't need to work. You're not in a position where it needs to work. But what you're doing is you're training your brain for when you do need it. So your brain is being told, this is what I want in the future when I need it, but it doesn't always work straight away. And a lot of even hypnotherapists I come across, "Oh, I tried that, but it didn't work. Or I couldn't numb myself, or I couldn't do this, or I couldn't stop my bleeding." I said, "Well, did you need to do it at the time?" "No." "That's why." But the moment you need to, it will kick in.
That's a very good reframe. And if you come with that authority and tell them that that's true, it probably is more likely to be true, which is cool too. You mentioned before that you listened to music while you were under general anesthesia. That's what we did as well when I was working at the hospital. We didn't do surgery without anesthesia. Everyone got anesthesia. This was called complementary medicine or integrative medicine when I was working at Columbia Presbyterian. So people got anesthesia. They definitely got pain meds and all that sort of stuff. And they also got hypnosis and the tapes of when they would go in for surgery, they had headphones on and they were listening to the hypnotic inductions and the music that we provided, et cetera. It's very, very interesting. But you also are talking about your students. You teach people how to do this?
Oh yeah, yeah. I've got some fabulous students at my school, and they've been with me, right from the beginning. I started training online actually, and I've got a core bunch of people, and new people keep joining. And I have a lot of students that are already pre-trained,
Hmm.
and they come and they say, "Well, I didn't do X, or I don't know exactly what you're doing, and can you
Yeah.
teach me those things?" So during my mentoring classes, they get to really experiment and do stuff. And we're big experimenters. I'm really into encouraging the students to experiment, but I also have sometimes a few people that come on and give talks. And recently we had somebody give a talk about how to read and write a scientific article. So now our next experiment is how we can do it as a group, to work with maybe a group or whatever. We're coming up with ideas to be able to write articles specifically for, you know, can everybody be okay with this? That, and if we give exactly the right kind of formulas in some way. So we always play around with things, but we also have, on my course, we tend to have live clients who are absolutely outside. Sometimes they're people that are my clients, or who wanted to be a client of mine, maybe couldn't afford my fees. And I will say to them, you know what, if you're up for it and you really don't want to be able, you really can't pay, would you use your time? And, therefore it's kind of a better and a good exchange to be one of my patients on the
Hmm.
course.
Yeah.
So a lot of the students get to play around and work with the client themselves. There's a lot going on. So teaching it has been, I teach a core program, and then the mentoring sort of is an extension. And since I started during COVID, I will say on my mentoring sessions, and I do about 2.5 hours every 2 weeks, more or less, sometimes every other week. I haven't repeated a session twice.
Hmm.
So I never know what's going to come. And yeah, my premise is deal with what emerges, as I was taught. And so I never know what's going to show up on that day.
And that is one of the beautiful things, and also one of the challenges about, sort of codifying a hypnotic practice. If you want to do a study in a medical situation, what we found, because like I said, I was there to do a study, they were doing a study at the time, and it was really hard to say, how much dosage of hypnosis are you going to be given? Should we increase the dosage here? What does that mean when it's hypnosis, when it's talking to a person? And to have the same script for each person, it just flat out didn't work for some people. If you're reading the same script for them, you've got to be interactive with that person that you're with.
Yeah.
It has to work that way. But it's really hard to codify that. And the thing about, doctors and the medical situation is they want to say, yeah, give them 10 cc's of this, whatever drug it might be, or that's sort
Yeah,
of.
well, I've definitely had conversations with people about this. Ted Capchuk from the Harvard placebo program, he actually taught on our course as well. And he's the lead director, and he and I have done, I've done some consultant work for him regarding how he wants to administer placebo, because he uses open label placebo, and he knows that there's a huge factor of hypnosis. He's written articles about hypnosis plus placebo, and
Mhm.
one of his colleagues, Arvin, also does hypnosis, and I say to him, there's definitely ways of offering the placebo, and what you need to do to make that, if you want it to work. So it's interesting, because he was trying to get some FDA approval for placebo, knowing on his research what has actually worked, and it has worked. I mean, he's got some
Yeah.
good stuff. So it's interesting. People, there's also studies done by Peter Worrell, Professor Peter Worrell, in Manchester University, in Manchester Hospital in the UK, and he had a study done specifically for irritable bowel syndrome, and it was the first time this had ever been done on the NHS, the National Health Service over there,
Mhm.
and he was getting a 70% success rate of cure, which only he was allowed to say, because of
Hey, the
course
word
he's a
cure,
doctor,
yeah.
you can use the word cure. And he brought me in and he said, can you do better? He said, I know that you've done better. I don't know how he got my details. It was years ago. And he says, I know you've done better with your clients. I want to know how to make this better. And I did have some ideas, but I did say to him, look, you're doing a generic process for everyone, and that's that's going to keep you at the 70%, which isn't bad.
Which isn't
But
bad.
if you want to go higher, then you need to make some of these things much more personal.
Yeah,
personal
for sure. So it's interesting, the placebo, saying this is a placebo. Here, take this placebo, because placebos have like a 50% success rate. So that's pretty good. Here, take this. And then Robert Dilts, one of my mentors in the NLP world, was suggesting that they make those pills and put them out on the shelves because they have a really great success rate. And then if people really need it, they can get extra strength placebos.
That's right. Well, this is what I talked to you about with Ted Kapchuk. And I said to him, with hypnosis and placebo, the better thing is potentially to start off heavy and then get lighter and lighter. And so we were talking about those kind of options. But,
right.
Anyway, it was a challenge to do to get what he had got funding, but apparently not enough. I mean, they need tens of thousands for this kind of stuff.
I know. Yeah, I know. It's a lot of money. And, takes time. It takes time for sure. But it's great work that you're doing. So if somebody wants to learn from you how to do what you do, where do they go?
Well, my training is on academyforhypnosis.com, and that's FOR. So Academy for Hypnosis, not the
number
preposition. So Academy for Hypnosis. And they can the way I start with people is, rather than going for full on training, I always say you book into the mentoring, get to know us, get to see us, and you get 2 free mentoring sessions. So you actually kind of get thrown in the deep end, because you never know who's going to be there. There might be a client that we're in the middle of working with. You just kind of go, okay, I'm now in the middle of working with somebody. But then you get to see, okay, well, how are you doing this and what are you doing? And then, of course, the best thing then is to do the training, and it's not expensive. I've kept it really low. So,
Great. All good things.
Yeah, thank you.
academyforhypnosis.com.
That's right.
All right. Very nice.
Yeah.
And you are in Central America? No, you're in...
I'm in the Midwest.
I'm in the Midwest. That's what it's called.
Yeah.
Down in Nicaragua. No, you're in Indiana or Illinois.
Indiana. Right now I'm in Indiana, but the training is all online. The whole thing is online.
Right,
yeah, and there are times where I am doing in-person classes. I've done quite a number of in-person actually in the UK. So because I've got quite a big body of students in the UK, and I've got quite a lot of students over in Europe, and so they fly in. But if I get more students in the US, I'll happily do something maybe in Chicago, Indiana, who knows.
Okay, great. Well, Sharon Waxkirsh, I now know how to say your name. Just like it's spelled.
Just like it's spelled.
When I'm not looking at your bio.
Oh, man.
Thank you so much for being here. It's
absolute pleasure. Thank you.
Yeah, we'll see you again.
Thank you.
This has been the Essential Coaching Skills Podcast. Thank you for being here. It's a pleasure seeing you again. Hope to see you again real soon. Come back next week when we have another gripping and exciting episode of the Essential Coaching Skills Podcast. And if you want to, you can find out more about us, each and every one of us, at essentialcoachingskills.com. Thanks.